Pfizer says its potential vaccine for the coronavirus is 90% effective. This as new cases are on the rise around the world and here in the U.S. Nearly 10 million Americans have tested positive for the coronavirus since the beginning of the pandemic. More than 500,000 people tested positive over the past 5 days alone in the U.S. The death toll now stands at more than 237,000 people. President-elect Biden addressed those staggering numbers with Vice President-elect Kamala Harris today, announcing his new coronavirus task force. Meanwhile, HUD Secretary Ben Carson is the latest member of the Trump administration to test positive for COVID-19. Carson attended a party at the White House on election night. Chief of Staff Mark Meadows was at that party as well and has also tested positive. Nancy Chen has more on the national outbreak.
Pfizer says early data shows its experimental vaccine is 90% effective. The FDA's bar for effectiveness is 50%, so Pfizer's shot could get emergency use authorization over the next several days.
This is an RNA vaccine, so these are the instructions for the spike protein of COVID-19 that are injected in the arm, and then the human body makes the protein itself, and an immune response is made to it.
Pfizer's vaccine is one of 10 possible vaccines in late-stage testing as the U.S. hits new milestones. Cases are now rising in 26 states. In El Paso, Texas, the city has now brought in 10 mobile morgues. In Utah, hospital overcrowding prompted the governor to issue a state of emergency and a mask mandate.
Utahns may not participate in or host casual social gatherings with individuals other than those in their immediate household for the next 2 weeks.
Alaska, Arkansas, New Mexico, and Colorado all recently hit record daily case numbers. That prompted Denver's mayor to impose a 10 p.m. curfew. Now, new worries of an even larger spike. This weekend, tens of thousands participated in mass gatherings, including here in Times Square, to both protest and celebrate the presidential election results. Health experts fear there were possible super spreader events.
Anytime when you put that many people in close proximity, you do run the risk of that transmission.
The family of John Bjorkman from South Dakota says officials need to ask more from Americans.
If I could have saved my father by wearing a mask, I would have done it. And I think most people would do the same.
Bjorkman was a school administrator and spent 30 days hospitalized before passing away. Nancy Chen, CBS News, New York.
And for more, Rashmi Jain joins me. She's a pediatrician and the founder of babiesmd.com. Doctor, welcome. Thank you so much for joining us. So Pfizer says this vaccine is 90% effective, which is pretty amazing and good news, certainly, it seems. How does this effectiveness compare to other vaccines that are still in, clinical trials out there?
Yeah, so this is a great question, and it's wonderful to be here with you today. The first thing to know is that the FDA wants us to have at least a 50% efficacy for any vaccine out there in regards to coronavirus or COVID-19. And for Pfizer to state that they've got 90% effective rate, that is pretty impressive. I know we're waiting to hear from the other vaccine research companies out there that are working on this vaccine run right now. But in the vaccine, so as a pediatrician, we give vaccines all the time. MMR vaccine, for example, has a 90% effective rate, 93%. The flu vaccine is only 40 to 60% effective. So 90% is spectacular, and we're looking to get more data from the other vaccine research companies out there.
Do we know any details about this particular vaccine Pfizer is developing, how it was developed? I know that one of them, I believe it was the AstraZeneca vaccine, was being developed using, chimpanzee cold viruses, which I thought was sort of fascinating. Do we know details, or are these companies being very proprietary about their trials?
Well, I think given the intensity of the pandemic and knowing how much everybody wants a vaccine as soon as possible, there's been a lot of information out there. So Pfizer, along with BioNTech in Germany, is using mRNA, which is basically the genetic code of the coronavirus, injecting that directly into human cells and causing the human cells to create a response in the body that then the body creates an immune response to. So the protein is created in the body itself, and the immune response of the body is created to fight this protein anytime it sees in the upcoming future. So this is actually new and novel. mRNA vaccines have not been used in humans till now. So this is very exciting, and it allows for, basically in the future, if there is a transition of the virus, a mutation, it allows for us to utilize this mRNA code in a more effective manner and hopefully get further vaccines in the future with different combinations that can be elicited by one's body.
That's great. So it sounds like the formula for this vaccine allows for adjustment and evolution as the virus potentially evolves, correct?
Yes, yes. And that's the very exciting thing about using the mRNA code.
That's great news. All right. So Dr. Jain, while the world waits for a vaccine, some Americans have expressed reluctance to get vaccinated once a vaccine is available. On 60 Minutes, General Gus Perna expressed concerns about those Americans. Here's some of what he told correspondent David Martin. Let's listen.
How much have you spent so far?
As of today, I think I'm at $12 billion, but I have projected that we could spend as much as $26 billion.
What's your worst nightmare?
We get vaccines to the American people and they don't take them. Shame on us. Hey, I was already sick. I don't need it. Shame on us. Hey, I don't believe in vaccines. Shame on us. Just shame on us. And it does keep me up at night.
It's pretty scary to hear that sort of scenario, that, right, to imagine that there may be huge populations of the U.S. that don't want to take the vaccine for one reason or another. So do you believe the medical community is going to have a hard time convincing the majority of the American public to get vaccinated?
This is an interesting question. So as a pediatrician, we all know that we handle this vaccine question a lot. There's a lot of parents who come in not wanting to vaccinate their children. There are many questions about the safety and efficacy of these vaccines. And so I often urge my families to remember that by the time a vaccine comes out for use in the general public, it has gone through a number of safety trials. It has been reviewed independently. There have been 3 phase trials, so testing thousands of people before they even come out to the general public, before they go to regulation and approval. So I think the most important thing to remember is sometimes when we're in a situation where there is no disease anymore, like, so for example, the polio, we don't see it anymore. People may question, do I need a polio vaccine? But with something like the coronavirus that is currently affecting so many people worldwide, more than 10 million people in the United States, and our death count is just rising. I mean, the American Academy of Pediatrics reported that in October alone, 200,000 pediatric cases of COVID-19 were diagnosed. So the reality is that we need to remember this is real and this is here. And so we have to do whatever it takes to reduce contagion of this virus, to make sure it's not infective to the number of Americans and people worldwide. And we also have to do whatever it takes to try and reduce the severity of the illness. And that is what these vaccines are working to do, to make sure that if we do get coronavirus after having vaccine, it's not as bad. And if we hopefully have a high effective rate, like Pfizer is saying, that we may not get it at all after the vaccine. The first and foremost thing is this pandemic is real, and we have to do our best to prevent it from continuing.